I think that the residency program at Iowa is among the very top residencies in the entire country. And the reason I think primarily is that we really place a strong emphasis on educating residents.
Our residents, when they complete their residency training, are very well trained to go out immediately and practice. The important part about this residency, I really believe, is that it's not service before education. It really truly is education before service. You still have to do a lot of work. That doesn't mean that the work's not there and has to be done, but there's a very high level of education provided through didactics, simulations.
I'm passionate about research. A lot of people are passionate about it. We want it to be a great experience for the residents and something that they actually learn from. There are a lot of different opportunities for research and scholarly projects. We have projects that range from quality improvement, quality analysis, to very basic science, to clinical and translational research. And so we really have the whole spectrum of research available because it's all being done in the department, and residents have the opportunity to be involved in all of it.
The rural tract is new, starting this year. The goal is to bring on a resident who is interested in rural residency. They may not have all the bells and whistles, and so they'll have to be more self-reliant. They would come and have a great, solid foundation to be able to practice independently or with a group and have that solid foundation that they need to be an independent practitioner.
I think I've grown more than I anticipated. I think as a medical student, you see all of the aspects of care, but really integrating them in residency is where I feel like I've learned the most. I feel like in medical school, I was really able to advocate for patients, but I feel like in residency, you really truly get to know the patients and operate on them and take care of them afterwards.
Well, Iowa City is a kind of a hidden gem nationally, I would say.
There's a great atmosphere in Iowa City where our diversity is incredible. The opportunities are incredible for dining out, for recreational activities. I really don't think you can find a better place.
Specifically, this residency, I think, has a huge impact in our community. I feel like our program has really worked to educate not only the residents, but also to educate the community in what is important to know in terms of women's health.
It's hard to find a place that is the perfect mix of Midwest nice and has all the amenities you can find in a bigger city, but still you can drive 5 minutes outside of town and be on a farm. It gives us the benefit as resident physicians here to take care of a very wide breadth of a population, and I think it's that mix of people that you're seeing from all different areas of life that makes this training special.
The whole idea of Iowa Nice is not a thing that's made up. I came from a really large city, and when we moved here, we were surprised how much we liked it. You know, you have to get used to that there's not 20 of everything. There's a few of each thing, but there's really high quality in those things, and the people here are very generous and giving.
I think one of the real benefits of being in the residency at the University of Iowa truly includes the down-to-earth faculty that we have here. These are faculty that residents can talk to, they can make an appointment to talk to, there is a great mentoring program where everyone has someone in the faculty that they can talk to and work through the difficulties that are occurring in their lives.
I've been here for 7 years, and it's a really great community. It's very much of a Big Ten community. I think that's what I love about this program too, is my husband and I will go to all the sporting events, so we've been to a bunch of Hawkeye games. Also, there's great restaurants downtown, there's a pedestrian mall, and everyone is very, very nice around the community.
Whether you are part of the physician team, the ancillary staff, the nursing team, we all work together. And I think that really shows in how we take care of our patients and how well we get along outside and in work. And I think that reflects on how you live your life as well, and just being an overall team player.
The most telling thing that I've learned over the years is that we do interviews of graduate residents a year or two after they've left the program and ask them, would you come back and do an OB-GYN residency at Iowa again? If you had to do all over again, would you choose Iowa as your training program? And virtually 100% said yes, that was a great decision for them to come to Iowa for their OB-GYN training.